Have you ever been in a situation where you're doing an athletic movement or you're watching someone do an athletic movement and you watch their knee kind of start to cave in? And there's just something about that that doesn't look right. Something about it makes you go, ugh. There's kind of a reason for that, actually. That movement pattern is called dynamic valgus. The textbook definition of dynamic valgus is internal rotation and adduction of the femur at the hip joint, knee abduction, anterior tibial translation, and external tibial rotation. And then, of course, the body is very connected, so there is movement in the foot and the ankle involved as well. So if someone's beginning an anatomical position with their feet about shoulder width apart, what dynamic valgus looks like is hip internal rotation, right, keeping all of this fixed, as well as slight adduction. The knee is in abduction, which is where the tibia, or the lower leg, is outward from the center. And then obviously there's going to be movement in the ankle and the foot. It's kind of like a foot pronation, but it's not proper foot pronation. And this is, as you've probably seen, if someone's performing something like a squat, this is absolutely what you do not want them to do. So you would never want them to be in a position where their knees cave together. So the average person probably is not set in this position anatomically permanently and walks around like this all the time. Most people have a semi-healthy anatomy at least. Dynamic valgus is when this movement pattern shows up when you're in a dynamic movement. So it often happens when people are trying to jump and their knees come together. Or an athlete is running and changing directions and the foot plants and this caves, right? That is where you're going to have your highest incidences of injury related to dynamic valgus. It's during a rapid, quick movement and the body is not capable of holding on to the force. And there's also two ways to think about dynamic valgus. The first is what's called bottom-up approach, and that is where you start at the feet. That's why I'm barefoot here. If your feet are in a position where they're very, very sort of fake pronated, is what we'll call this, then obviously, as you can see, the body's connected, the knees start to come together. That's already in the adducted position, for the femur adducted position, right? And then obviously, if your knee is coming towards the midline of the body, that is, tibial abduction, and then that also naturally is going to kind of lead to an internal rotation of the hips, because if you fix where your body is here and you start bringing this in, you can't really go very far, right? Because the position of the hip at the edge. So the hip naturally, to compensate, has to start to roll in order to allow this in. So that's kind of the bottom-up approach. And then this position, when both hips are in internal rotation, as you can tell, maybe, is also not very good for the spine, because you're almost immediately in anterior pelvic tilt position, right? So that leads us to flip it. Now you can also think about your top-down approach. So here, you start with the hips and the glutes. So if you were to squeeze and engage your glutes properly and brace your core a little bit, I'll show you from this position. If I start in valgus and I start in anterior pelvic tilt, right? You can see that here. And I naturally squeeze my glutes and brace my core like getting a good athletic position. The knees come out on their own, because squeezing the glutes, especially your external rotators, that would be, involved. And by glutes, I mean that whole musculature region. By squeezing the external rotators, you're obviously externally rotating, and that comes naturally with a little bit of femoral abduction, okay? So that's one of the reasons that bracing your core and squeezing your glutes is really good for being in an athletic position. From this position, you can see that, yes, my feet are kind of in that rolled in position. If I am to, like I said, properly brace and squeeze, I don't know how well that shows up on the camera here, but the weight shifts from right along this inside line of my foot, kind of in line with my big toe, probably over a toe or two, to sort of the middle of my foot. And the weight's now split between the ball of my foot and the heel. Essentially, if I'm to zoom in on this a little bit, right here, where the arch is, you can see arch is very flat, and then if I'm to squeeze and brace, as I mentioned, and focus on fighting that position, the arch starts to come up a little bit. So there are your two ways to think about dynamic valgus, and that gives you two ways that you can work on preventing it. One is to strengthen your glutes and your core brace, which will externally rotate your femur, and the other is to increase the mobility and flexibility and strength of your feet and your ankles, because that can support from the bottom up. Have a wonderful day, everyone. I hope you learned something here.